Are you on social media?
No.
Wow. Yeah, that's do you think is it something that has affected your practice, or have you just said, forget it, I'm not doing it? People, I mean, obviously you're pretty established.
Yeah, well, it sure affected my practice. I mean, my history there is that I didn't have a website till about 5 or 6 years ago, and it suddenly dawned on me that people didn't have phone books anymore. So if they didn't have a phone book, how are they even going to find my address? So that's why I got a website. Uh, but things like Facebook and other social media things to promote myself, I just never got into it. As I said, I don't have a problem with a young surgeon doing that because I think they probably feel they need to, but I didn't do that, and I had lots of patients, and I didn't need any more patients. They had a waiting list to get in to see me, or people were waiting a year to get in the front door. Then why did I want to make them wait 2 years? So anyway, for me, it was a no-brainer. I just didn't need to go there, but it's different for a person starting out. It just is.
So you'll have a unique perspective on the whole social media. I mean, I've got my own views about it, but I wonder if already my views about it and our views about it are outdated. It takes me back to when the internet was just starting and websites were
Yeah,
starting, and there was this big debate about whether there was a role for websites and the internet in
yeah.
medicine and in plastic surgery. And now you look back and you think, what a ridiculous, debate that was. I mean, obviously there was a role. I mean, you couldn't exist now without having an online kind of strong online presence, but
Yeah.
and patients really use it for evaluating people looking for results and and I think it's really helped the education process of patients, because now my patients, I mean, I'm sure yours are the same. My patients come in almost as educated as like a junior resident. I mean, they know
Yeah.
the procedures. They even know the newest cutting edge procedures better than better than some surgeons do, really, to be quite honest. So
That's right.
it really, that I take it back to when the internet was starting and people's views. But now I wonder about how social media has played, particularly over the last 2 years. And I think it comes to me a little bit, it amplifies this question of how much of our specialty should be treated like a discipline of medicine, and how much of it is really like a retail industry, because those industries behave very differently on social media, distinctly, and the regulations for those industries are very different and don't necessarily seem to come together in a very smooth way.
Arjang, that you're describing these two Venn diagrams, which is the commercial side of aesthetics and the medical side, and somewhere in the middle, these things overlap. And I think it requires a delicate touch as a doctor to maintain the position of somebody who, as I said earlier, is advocating for our patients, who's doing the right thing for the patient. So is the right thing for the patient to do something that has low risk, perhaps, but that brings in a lot of money for a practice? Is the money the reason that it's being done? If that's the case, I think we have to consider, well, what about that low risk? Should there be any risk at all? Certainly, the patients have to be informed on this. And I have a feeling that if we go into surgery and we train as a surgeon, but we end up in a field where we don't do surgery anymore. It's we have a medical spa, and we I don't have a problem with medical spas and injectables and fillers. But if that's all you do, then maybe you shouldn't have trained for 5 years to be a surgeon.
Yeah. Or I mean, you could also make the argument maybe it makes you a better injector, knowing that side of it, right? I mean,
I think you're dead right. But again, if that's what we need, if that's what we want to do, if we want to train people to do that work, uh, why should we make them do a residency for 5 years just so they know where to put the needle and find the corrugator? There's got to be a better way.
Yeah, I mean, I see your point. I don't know how to bring those two worlds together, however, because I think there still is a real role for the plastic surgeon who's got solid training to bring that to the non-surgical world. Um, I'll bring you back to this social media question, because it's something that I think about a lot and kind of try to grapple with, and I don't know if there's really any answers. But even something like in Ontario, we're going through these new regulations on social media and what's appropriate for
Mhm.
social media advertising, and I get it. In some respect, the regulations are meant to cover all of medicine. So, the regulations for a plastic surgeon, I think, are meant to be similar to, a cardiologist who's also kind of dealing with drugs and prescribing patterns and whatnot. But it is very different. It is very different in plastic surgery because there is a kind of this component where patients are purchasing products and they have to like what they are getting, and there are very distinct services that patients may like for various reasons. The other part of it is that it's so global now, really. It's almost ridiculous to me to think of having regional regulations for social media, or kind of even the way you kind of put yourself out for rules about social media that are not global in nature. Because when our patients follow somebody, they're following somebody from Brazil and somebody from Los Angeles and somebody from Vancouver and then somebody from Toronto. They're not just following everybody in Ontario. you know, you know what I'm trying to say here? It's almost, I wonder, if it's not global, what is the point? Almost. But then, there has to be some rules because it can't be. You have to protect patients in a sense, but I'm not even sure if there's a question in there. I guess the question is, um, how 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 much credit do we have to give to patients to be their own kind of savvy deciders of information on social media versus creating rules externally?
Right. Well, a couple of comments. The first is when you mentioned cardiology or any other part of medicine, I agree that there's private sides to all these things, but the difference with plastic surgery and aesthetic surgery is that what we do is completely unnecessary. I mean, these other guys are doing something that at least have a medical component to it. A facelift or a breast augmentation arguably is an unnecessary thing. So I think the bar is different in terms of how far we should have that bar before we force people to or try to persuade somebody to do something that they don't really need. But I kind of agree with that concept, Arjang, that the social media is a worldwide phenomenon. And the only logic I can see for having local rules would be if the College of Physicians and Surgeons in your province or in the United States and the medical board in that state uh, decides they want to regulate the ethics and behavior of doctors, then I suppose it would be reasonable to regulate what they do with social media. But from the public's point of view, it's irrelevant. They log on and they don't know where that uh, person is. But I can see from the regulator's point of view what they're trying to do. They're trying to make me in British Columbia toe the line according to their rules for all doctors, and I guess that's their job.
Yeah. You told me a story about a patient who brought in a selfie, and I was I kind of was laughing thinking about this, and I suspect what they were doing. So this patient, just to kind of tell everybody, you're telling me that patients bring in selfies of themselves, and I presume they've got filters, so they're altering their face with a filter and asking you to make them look like whatever it is the filtered selfie is. Is that right?
Yeah, well, I call it the selfie generation because there's a generation of people who have taken pictures of themselves using a cell phone, which has got a wide angle lens. It distorts your face already, and they hold it as far as their arm can reach, which again distorts your face, makes your nose look big and all that stuff. And there's two phenomena there. There's the person who comes in with a selfie, especially I find this with nose patients, and they say, well, here is the problem. And they show me on their cell phone. They're going like this, and I say, well, wait a minute here. Why don't we look at the real person? You're here. There's your nose. It doesn't look like that when I look at it in real life. And they say, but really, I don't care about that. I care about these pictures. And so I think there's been a bit of a move towards trying to, for the public anyway, to look good in a selfie, to look good on their cell phone pictures, when in fact that it might be a different objective than making them look good in real life. In fact, I heard a guy at a conference a while ago say that, there's the standard medical photography we do from, position of the face this way, and this way. And maybe what we should do is add selfies to the list of standard medical photography so we could compare pre-op selfies and post-op selfies. And
Yeah.
interesting failed.
But you get them coming in with filters. So there's
You do, yeah.
filters for everything, and there's facial optimization filters where you can actually look like you've already had surgery with a selfie.
Yeah, large Anga, I'll tell you about a facelift patient who shall obviously go nameless here, but she had filtered and morphed her face to look quite different, and had pictures of celebrities. And she was looking at having a facelift. This woman was having a facelift, and I had her bring in old photos. I like to see the way they used to look in their 20s and 30s, because to me that's the objective. And we were looking at that picture where she said to me was, well, that's all very good, but I don't want to look like that. I want to look like this. So in fact, just going back to the way she was not what she was interested in. She wanted to look really quite different.
Yeah, I know, and I've had that experience too, where they get these optimization filters and they want you to make them look like this, and you're like, really, that's a CGI graphic essentially.